Hello and welcome. It's 11 a.m. here in Seoul. I'm Ji-young at the Arirang News Center. We're breaking into our regular programming to provide you with the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection of the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. We should be getting a breakdown of the number of new infections as of midnight, as well as any trends and possible updates and the latest on the vaccine campaign. Also, the efforts that the government is making to contain the virus. We'll take a look at the briefing.
Let us now begin our regular briefing for April 23rd, Friday. Today we had discussions, and here are some updates on our discussions. And yesterday we also discussed the importance of the minister responsibility in taking care of the on-site inspection duty. And we have looked at the multi-use facilities that have been prone to cluster infections, including logistics centers and call centers, as well as indoor sports facilities and preschools. And to this end, the Central Minister of the Central Ministry has visited the sites personally and also discussed with the related members of these fields, and also will be reflecting any of the opinions going forward. And also we have about 21 government ministries which will be exerting its full efforts to carry out full-fledged efforts to have full control over the many multi-use facilities. And today we were updated by the Minister of Culture, who is in charge of the indoor sports facilities. And in order to intensify the ministry's effectiveness in monitoring the quarantine measures at these facilities, it is also cooperating with related associations, and it is also expanding the scope of the on-site inspection. And especially starting from January, the minister and the vice ministers have been visiting these facilities personally and physically, and they have been looking at the conditions by themselves. And as for the indoor sports facilities safety campaign, this is also being rolled out to the related associations and members of the associations, and they are also opening their ears to any of the opinions from the fields. To this end, we are also going to look at these related facilities and related systems and schemes, and we will also be providing the details to the public on a regular basis. And starting from next Monday in Gyeongsang-Buk-do Province, in Guni, Uiseong, and Ullyeong-do Province, they will be having a new social distancing campaign starting from next Monday. And these regions have less than one case on a daily average, and they have a relatively stable COVID-19 situation. And many have been raising the opinion to and the need to also adjust these social distancing measures, especially for these cities and counties. And to this end, we have been providing and having continuous consultations with Gyeongsang-Buk-do Province, and they will also have a pilot run of the level 1 social distancing measures. However, they will still have in place the regional social intensified social distancing measures, that is for the religion facilities, and they will also have intensified quarantine measures for tourist destinations. And to this end, we are also continuously seeking ways to have cooperation with the local communities going forward. And as for the self-test kits, we are undergoing the review of the Ministry of Food and Drug Safety, and the details will be rolled out by that specific ministry today afternoon. And here are some updates on our update on the medical response capacity. Right now, our rate of the critically ill patients, which mean the amount of number of the critically ill patients among the total number of patients, this has decreased significantly to 1.5, and totally 1.6, that is in March, from 3.3 in early January. And we also have about 2.7%, which is the infectious rate. However, this has also decreased continuously, and it is below 0.5%. We believe that these can be attributed for two factors. First of all, we have the relatively vulnerable group, especially the senior groups, and the facilities that are frequently by these groups are under strict quarantine measures. And currently, right now, we carry out a regular weekly PCR testing for all of the people who are working and residing at the nursing hospitals and long-term care centers. And second, we were also able to roll out the vaccines to the people who are working and living in these facilities. And many of our senior citizens have been taking part in the vaccination program. And to this end, we were able to decrease the amount of infections, especially at these facilities, which has helped us to decrease the infectious rate among the senior citizens. Currently, we have 766 critical care beds available for immediate use, and out of them we also have about 591 that can be used immediately. And we believe that this also means that we can deal with the patients even if we have about 1,300 daily cases in the near future. And in the past November and December, we had only about 50 critical care beds available, and we have continued to upgrade the securing of the hospital beds going forward. And currently, we also are carrying out continued vaccination rollout. And if we complete the vaccination rollout for about 12 million by the half of this year, we believe that we can significantly contain the virus. And if the rate of our critically ill patients drop to below the 2% level, we believe that we will also have a very abundant room for these medical response capacity going forward. And today we had 758 new local infections and 39 new imported cases. We had 3 additional fatalities yesterday, and I extend my deepest condolences to the deceased and the members of the bereaved families. And yesterday we had about 130,000 people who were inoculated on a daily basis yesterday, and until yesterday our total number of the vaccine recipients, that is, surpasses 2 million, and we will also exert our full efforts to reach our goal of 3 million by end of this month. And to this end, we will be also aiming to carry out the inoculation for about 12 million by the half of this year, especially including those who work in the essential social care fields, as well as the care providers and the healthcare providers as well. And I sincerely hope that we can also contain the virus thanks to these vaccination rollout programs, and we will also exert our full efforts to help you to return to a state of normalcy. Thank you very much.
That was the government briefing on the COVID-19 situation here in the country. South Korea reported 797 new COVID-19 cases on Friday. This brings the accumulated number of cases to 117,458. There have been 3 more deaths, raising the death toll to 1,811. We'll wrap up the coverage here. We'll be back at 12 p.m. Korea time for our midday news with Mark Broom. Bye for now.
This is the last remaining divided country in the world. Though the two Koreas are vastly different places